Hi, today we're going to talk about hair loss in women. This talk could also be subtitled, "Oh my God," or "Where is my hair?" It's really a common problem and it's really distressing. In order to understand hair loss, you should probably know about what is normal hair. The normal woman has about 100,000 follicles on her head. It varies by color. Blondes have 150,000, redheads have about 90,000, and the thickness also varies dramatically. Somebody's hair can be twice as thick as somebody else's, and it's very normal. There's 3 stages of the hair cycle. The growth stage, and that can last from 2 to 8 years. So some hairs on your head can actually be 8 years old. There's a transition phase where the follicle shrinks. That lasts only about 2 weeks. Then it grows into a resting phase. For about 2 to 4 months, it just hangs out, not growing, just resting. And then at the end of that period, it falls out. Any normal, healthy woman loses 50 to 100 hairs a day. That's 3,000 hairs in a month, and that's totally normal. Okay? If you do start thinking that you're having hair loss, it's important to get a doctor's evaluation. There are different causes that can be treated. Some of the workup your doctor may do is looking for hormone imbalances, so more male hormones or prolactin. So if you start finding that you are growing facial hair or secreting milk, those can be associated with a hair loss. The menopause is the most common hormonal dysfunction. It's not a dysfunction, it's just normal. But it causes an increase in male hormones and a decrease in female hormones. And the balance is then more male to female than it used to be. And that gives you more of the male loss of hair. There are a lot of medications that cause hair loss, too many to mention here. So if you're taking a medication and you think maybe it's causing hair loss, the first thing you do is look it up and see if it's associated with hair loss. The second thing to do is talk to your doctor and see if there's another way to treat your condition. There are certain vitamins that in excess, too much, can cause hair loss. So vitamin A, which is found in fish oil, so people taking a high dose of fish oil may be causing hair loss. Selenium and DHEA, also in health food stores, too much can cause a problem. Vitamin D, on the other hand, too little is an issue, and iron deficiency anemia can also be associated with hair loss. General thyroid dysfunction, too high or too low. Fungus on the scalp can cause hair loss, and rarely something like syphilis, and autoimmune diseases are actually not uncommon in women, and those should be evaluated as well if you're having significant hair loss. There are other causes that we ourselves are doing. So tight braids or hairstyles, pulling at the hair, caustic chemical processing. Stress can be a temporary hair loss issue. It pushes more follicles into the resting phase, but it's temporary. Postpartum as well. Postpartum, your hair does fall out. It is a normal situation, and it will come back. There can also be temporary precipitating events like surgery or COVID, and weight loss. Good for you. You lost 20 pounds, but you're losing a little bit of extra hair. That can be normal, and that also comes back. So the most common issue is female pattern hair loss. It's also called androgenic alopecia. So it's menopause, essentially, where we talked about those male hormones being a little bit higher than they were and the female hormones being lower than they were, and that balance being shifted. 90% of hair loss in women over 40 is actually female pattern hair loss. It affects 50% of women, so incredibly common. It starts with a diffuse thinning, usually at the top of the head, the spreading of the part. It can also start along the sides, and rarely you can find a receding hairline. That's much more of a male pattern. You have to be a little more worried than that with that. The female pattern hair loss is most common around menopause, obviously, because of the hormonal shifts. The biggest risk factor is family history. It can come from either side, which is why I should not have been surprised. But I had my own where is my hair moment. What happens is the growth phase is shortened, and there's a longer time between the time where the hair falls out and starting a new growth phase. So hair thins. The other thing that happens is the hair follicle shrinks and it produces a shorter, thinner hair shaft. That's called follicular minimization for my doctor pals who are watching this. Luckily, there are some treatments. We're having much more success with hair loss than in the past, so I'm going to share some of those with you. Every treatment has a varying level of success for the individual. They work best by preventing hair loss instead of regrowing hair. So if you can catch it earlier, it's easier to treat. Once the hair follicle is dead, it's dead. So you're not going to take somebody with a really bald head and regrow those hairs. It just doesn't happen. And when you start with your treatment, whichever treatment you choose, you can actually have a temporary shedding event where more hair is falling out and you might start to freak out, but you want to get through that initial phase and then the hair will grow back. So this is for my my stylist who helps me with my hair, and she mentioned massage. So I did look up massage, and massage, there was a study that showed that if you stimulate your head with massage 20 minutes 3 times a day, nice deep tissue massage, it actually increases hair growth. I personally don't have an hour a day to spend massaging my head. I wish I did, but I don't. So I moved on to some of the lesser involved treatments. So minoxidil, it used to be called Rogaine, but it's now generic minoxidil, Minoxidil. Minoxidil is a high blood pressure medication that was developed in the 1970s. And they found that about 80% of people had hair growth. What it does is prolong that growth phase, so you have less shedding and increase in the hair length. The diameter of the fiber gets thicker, making a stronger hair and reducing breakage. And it comes in 2 forms, topical, and there's more focus recently on an oral form. So topical, it used to be under the brand name Rogaine, but now is just sold over the counter generically under minoxidil. There's a 2 or a 5% solution or foam. It's applied directly to a dry scalp twice a day, and you massage it in to reach the follicles. Just of note, there have been some studies that show that once a day is pretty darn effective. So if you want to do it once a day, it's probably reasonable to start there. It starts working in about 2 to 4 months. Its peak effect to know if it's going to work is 4 to 6 months. And really, they recommend a trial of 6 to 12 months to see if it's going to work for you. There are some issues. You can get unwanted hair growth if it touches other areas. So for example, if you start getting it too far down on the forehead, you could grow hair there. There can be irritation, mostly from the alcohol in the product. And the hair can be different from the surrounding hair. It's usually lighter and finer. It may be a problem or it may not be. The oral form of minoxidil is not FDA approved. It is an off-label use. It is by prescription only. Okay, so you have to go see your doctor. The normal dose of minoxidil for blood pressure control is 5 to 40 milligrams. The dose for hair growth is minuscule. It's 0.625 to 2.5. So even the highest dose for hair growth is half a dose that could be used for blood pressure control. You want to start really, really low and go up slowly to avoid side effects. It's generally well tolerated at these really low doses, but it's not a risk-free medication. Usually in the doses found for blood pressure control, there are effects that can affect side effects that can affect your heart, your lungs, can cause fluid retention, bloating, flushing, numbness. It is not for use in pregnancy or with breastfeeding, never. And it can have unwanted side effects such as hair growth in the wrong places. There is also something called low-level laser therapy, LLLT. It is a laser cap. I'll show you mine. Okay. Got little lasers in it. It's a hat. It has shown promise, mostly for maintaining hair, stopping further loss, but it can increase hair density and may actually stimulate new growth in certain people. It's better tolerated than topical minoxidil. And like all hair treatments, it takes time. You can add minoxidil to the laser therapy, and the two together have actually been shown to be really efficacious, works really well. There's a downside is these caps are pretty expensive. There's no long-term safety information. And a lot of them actually have a money back guarantee to get you to try it and see if it works. There is something called platelet-rich plasma, PRP. It's usually given by a dermatologist. The dermatologist takes your blood, your own blood, separates it down into a portion where there's a lot of platelets. In that portion, there's also a lot of growth factors. You take that and you inject it into the scalp to stimulate the hair follicle. It's like 30 injections into your scalp. The sessions are about, you start with 3 sessions, 1 month apart. Locally here, they're about $1,000 each session. Then you have to do maintenance sessions every 3 to 6 months, depending on your hair. The likelihood of success with female pattern hair loss is about 25 to 50%. My dermatologist gave no money back guarantee, but she was pretty clear that it works in about 30% of people. And it can also be combined with other methods like minoxidil. There's very few serious side effects. And the main complaint was pain, obviously, if you get 30 injections into your head. There's another product called microneedling, another technique. And what it is a roller covered in tiny needles that you roll over the scalp. Okay. What it does is cause tiny little minor injuries that stimulate the healing. And because there's stimulating cells there, it stimulates collagen production. Collagen is that structure of the body that gives the skin its elasticity, and gives the hair also elasticity and growth. This microneedling is mostly used to augment something like minoxidil or platelet-rich plasma, but it could also potentially work independently. Getting it done professionally is the recommendation. That can cost anywhere from $200 to $700 a session. There is a home version. Some of the concerns with that are you don't know what size needle to use. You can't see the area that you're trying to needle, and you don't know how hard to push or when to stop. And in my opinion, you are rolling needles on your head. So, maybe better to leave that to somebody who knows what they're doing. Everybody always asks about vitamins and hair loss. There are vitamins that affect healthy hair, but those vitamins can be obtained in a regular healthy diet. Supplements have only been shown to be helpful if there is a significant deficiency. So it's recommended that when you see your doctor, if you think there's a vitamin deficiency because you're not having a healthy diet, that they actually check those vitamin levels and prescribe what would be needed to replete. You want to be careful again with DHEA and anything that contains a lot of vitamin A, like high doses of fish oil, because both have been associated with hair loss. Some healthy hair hints from the Dermatology Association. Wash your scalp and not your hair. Use conditioner to make combing easier. Wrap your hair in a towel instead of rubbing. Air dry and use fewer hot tools. Use a wide tooth comb or brush on the hair while it's damp and not wet. Use hairstyles that do not pull the hair back, or at least use coated rubber bands so you're not pulling the hair out or breaking it. Extend time between coloring, especially in the winter. Consider using a darker non-stripping color, which could thin the hair. So I'll tell you my story. I'm not very observant. I didn't notice that I was thinning, and I stood in front of a mirror with my glasses on, which I never do, and could see my scalp with the light shining through my hair, and I freaked out. I spent about 2 weeks combing the literature, looking at every study and every paper, looking for what works and what doesn't while I was waiting for my dermatology appointment. She diagnosed female pattern hair loss. I thought, no way, it's got to be something more than that. No, I mean, I should have known. My family, has a bunch of women with not a lot of hair at the end of their life. So I accepted that. I finally bit the bullet for a laser cap, which did really stop the hair loss. It was even starting to fill in some gaps when I got COVID. 2 years of working directly in the hospital with COVID patients, didn't get COVID until I did one office session. Got COVID, and a month later, I just had a massive shedding event, at which time I decided to try the oral minoxidil. I'm really sensitive. I tend to react to anything topical, so I tried the oral minoxidil instead. I started at a super low dose, the 0.625. I did have headaches for about a month, and I thought, well, maybe it's allergy season, maybe I have headaches from something else, but then they went away and it stabilized, and I had no symptoms after that. My hair did come back. I'm never going to have a lush head of hair. I never did. It's always been thinner, but at least I have hair. And so I've been pretty happy with the success. I hope this information helps you, and good luck.